My name's Colleen Tewksbury. I am the Bariatric Program Manager, and I'm really happy that you're joining us. So for today's topic, we are excitedly discussing medications and weight management treatment. So we have a true expert with us today. We have Dr. Octavia Pickett-Blakely. Dr. Pickett-Blakely is the director of the Gastrointestinal Nutrition, Obesity, and Celiac Disease Program here at Penn Medicine. She's the medical director of the PCAM Gastroenterology and Hepatology Clinical Practice, and she works very closely with the bariatric team to help facilitate your care. So we are excited to have her with us and have a true expert. So welcome, Dr. Pickett-Blakely.
Thank you. Thank you, Colleen, and good evening, everyone. It's an absolute pleasure for me to be here with you. Forgive my technical difficulties. I've been doing this for years and years, but wonders never cease to amaze when it comes time to actually presenting. I'm happy that we got everything all worked out. So this evening, I have a few slides, I think maybe about 9 slides, to discuss our options for medications that we can use for weight loss. And I played around with the title of this. I usually have kind of a snazzy title or something kind of witty and funny, but this is pretty dull and dry, which is what you get on a Thursday afternoon at 5 o'clock. But drug therapy for weight loss, okay? So Colleen, if you can advance to the next slide. So do not be intimidated by this. I know my bariatric patients are extremely well informed. They're smart individuals. And I use this as an introductory slide when I give talks to physicians, to nurses, to medical students, to other trainees in medicine. And there's no reason that you can't understand this as well. I'm not going to go through the gory details, but I put this up to sort of set the tone. And I'm sure I'm preaching to the choir here, just so that we all recognize that maintaining weight and managing excess body weight is extremely complex. And so that's really what I want to communicate with this slide. There are factors including our environment, the way we are raised, our upbringing, individual behaviors, couple that with hormones and all sorts of processes that go on in your body, your genes, that ultimately contribute to your baseline weight and when you gain weight and or lose weight. And so I only showed this complicated slide to reassure you and to let you know that it is complicated and there is not one thing that works. You usually like to employ multiple modalities and multiple mechanisms. So this is not at all to intimidate you. I just want you to let you know that maintaining weight and losing weight is a complex process and that you have to sort of pull out all the stops. Okay. I want to call your attention to our person right in the middle there. Our stick figure in the middle there is on a seesaw. And if you remember, I'm pretty sure lots of playgrounds still have seesaws these days. But if you can just think about your ability to maintain your weight as the balance between the energy that comes into your body and the energy that goes out. And I want to focus there because those are mostly the factors that are modifiable to us. So we can monitor and we can modify what goes in. And in many instances, we can modify the energy that is sort of spent or burned. But things like environment and other behaviors are sometimes less under our control. So I just put this up so that you recognize that we understand how complicated it truly is. Next slide. So is there magic in weight loss? Many of you have had bariatric surgery or you have a family member who's had bariatric surgery or considering a bariatric surgery for yourself. And I'm sure that you've heard that there is no magic. So if you can just hit the advance button, Colleen, you know that this beautiful wand, it doesn't work. The magic wand doesn't work. And if you could keep advancing, but what does work is employing all of the different tools that we have, including exercise, modifying what we eat, modifying what we drink, all of those things sort of contribute. So Colleen, can you just hit the advance? I have animation, yeah. And then in addition to modifying our diets, exercise, there are some medications that can sort of augment your efforts for weight loss. Next slide. So before we get into the individual drugs, I just want to sort of call out some caveats to drug therapy. As exciting as using drug therapy for weight loss is, we just have to recognize that there are certain caveats. Most medications are not covered by insurance, and I think that everyone should understand that going in. Now, there are some creative things that we can do to workarounds to get you medications. For example, many of the medications are on the older side, and so even though they're not covered, they are available in what we consider the generic form, and the generic forms tend to be more affordable, and I'll talk about that when we talk about phentermine. Medications require drug therapy, just the way that you follow up in the office, you get your micronutrients, your vitamin levels checked. Being on drug therapy for some of the drugs requires frequent monitoring. And I'm sure you know this, but I'll just sort of state the obvious here that there are no magic pills. These pills, when these medications are studied in clinical trials, they are studied alongside healthy eating practices and consistent exercise. So you're not going to find a study that shows that a drug works without these sort of healthy practices. And in my practice, I'm pretty stringent about starting medications when I'm not convinced that there are healthy eating practices and consistent exercise in place. In terms of expectations, I'm not sure if anyone in the group here has seen me in the office, but I'm pretty big on managing expectations because I think that sort of sets the tone for your success. I typically quote ranges in terms of weight loss. So I'm not the kind of doctor that you'll come to see and I'll say, you will lose 100 pounds, you will lose 50 pounds. That's just sort of not the way I operate. I like to operate in ranges, and we have goals that are sort of rolling, and so that we can be more agile when it comes to medications. I'm sure that you've all had experiences where you set a particular goal, and it could be weight or with anything else in your life. And if you don't hit that goal, you have a sense of failure. You feel like you haven't done your best. And when it comes to weight, recognizing how challenging it truly is, there's not a whole lot of utility, and it's not very helpful to set expectation unrealistically. So we set a goal, and sometimes that is not gaining weight. You know, sometimes that's losing a certain amount of pounds, depending on what else is going on in your life. And we set that goal, we move toward that goal. Once we get to that goal, we sort of celebrate, re-strategize, and move on to another one. But in general, when you're looking at how much you can expect from medications, 5 to 10% of your baseline, so where you are starting from when you start the medication, with healthy eating practices and consistent exercise, are the general expectations. And medications, you know, we have to be honest, they're not medically appropriate for every patient. Just like, you know, some patients are not appropriate for surgery, medications are not appropriate for other patients. And I'll go through some specific scenarios with specific drugs. There are sometimes that there are other medications that make using a certain weight loss drug unsafe. There are some instances where a particular medical condition may make use of certain medication unsafe, but that's what we are here for. That's what the medical professionals are here for, to go through, complete a full evaluation, and present you with the options that are best for you. Okay, next one. Okay, let's jump right into it. So I'm going to go through these drugs in terms of their classes. So let's start with the appetite reducers. And, you know, I showed you that first slide about how the mechanisms of maintaining weight, recognizing so that we could all sort of establish that your weight is more made up more than of just what you eat. However, when we think about medication, the first medication that was approved for weight loss was an appetite suppressant or an appetite reducer, and that's phentermine. Phentermine is the generic name, and Adipex is the trade name. So the way this drug works, it's a stimulant, and it works similar to an amphetamine. These are medications that sort of rev up the flight or flight system in your body, if you will, and some people say it speeds your metabolism, but it actually doesn't. It sort of gets that part of your body that is involved with the physiologic activity of your body revved up a bit. For this medication, if you can imagine, it requires a healthy heart. So if we're going to rev up, an individual, they need to have a healthy heart. They need to have good blood pressure and good heart rate. This medication, because it is a stimulant, also sort of stimulates you. When you take it too close to bedtime, it can interfere with your sleep. Some patients notice that they have a jittery sensation or sort of feeling, sort of hyped up a little bit, that tends to subside after a short period on the medication, but just to sort of prevent the issues with sleep interruption. I typically recommend that you don't take this medicine too close to bedtime. It is required when I'm prescribing this medication that you check your blood pressure frequently, heart rate. I usually don't use it in patients who have a history of cardiovascular disease, heart attacks, and uncontrolled blood pressure. The other thing that I like to do in terms of monitoring is I usually will monitor blood work just to make sure that your electrolytes, so in other words, your potassium, your calcium, and things like that are doing well while you're on the drug. Advance. And so phentermine is a pretty old drug. It was approved, I think, around 1959. And some of you may remember fen-phen. That was a notorious weight loss drug that did really well in terms of weight loss for many patients. However, the second part of fen-phen, so there were two phens. There was phentermine and fenfluramine. Fenfluramine was a drug that unfortunately caused problems with heart failure and heart valve issues, and so that drug was withdrawn from the market. But because phentermine remained a safe drug, that still stayed on the market. So phentermine sort of trucked along, and then it was combined with a drug called topiramate for the combination drug Qsymia. And topiramate, some of you may have heard of it or you may be using it. The primary indication for that drug is actually seizures. So this is originally it was approved as a seizure medicine. It also was approved for migraines. But when they were studying this medication for seizures, they noticed that the mice were losing weight. And although the mechanisms of the weight loss are not entirely clear, the combination of phentermine with topiramate results in significant appetite reduction as a result of that. Weight loss occurs. Okay. Can you advance to next? So some things to consider when you're thinking about appetite reducing medications. There's a real fine line between appetite suppression. And what I mean by that is there are patients who actually don't eat enough, if you can imagine that. There are also situations where the composition of your diet in terms of fiber and protein is inadequate. And what we don't want to do is suppress your appetite to the extent that you don't get in the vital nutrients that you need. In addition to that, there can be drug-drug interactions. So in particular, mental health drugs. I mentioned that the phentermine is a stimulant medicine. So I'm quite apprehensive about using a drug like this with too many other mental health medications. And actually, I just saw a patient today who had a pretty hefty regimen, and to add phentermine to it could sort of send things in the wrong direction. And then, of course, you need to monitor mood. Patients who have a history of, in particular, bipolar depression or mania, because this is a stimulant, they have to be watched extremely closely to make sure that their mood doesn't go in the wrong direction. Okay, next. Okay, so the next class, I categorize these as the metabolic drugs, and I call them the metabolic drugs because when you take in energy, when you eat, there are processes, and I'm a gastroenterologist, so this is near and dear to my heart. There are processes that are involved with your digestion and your absorption and your handling of nutrients. It's not just a matter of what you take in, but it's also how your body handles what you take in. And one of the medications that can alter the way that you digest and absorb fats is called orlistat. So that's the generic name. The trade name is Xenical. So Xenical probably came out maybe about 15, 20 years ago. It is now over the counter as Ally. And the way this drug works is by reducing the amount of fat that you break down. So it blocks an enzyme in your gastrointestinal tract that is responsible for breaking down fat. And so that results in a reduction in the amount of fat that you absorb. So it doesn't reduce your fat absorption 100%, but your fat absorption is reduced by about 25 to 30%. And so that's the way that the medication works. Now, if you can imagine, if you don't absorb the fat, where do you think it comes out? It comes out in the stool. And so the side effect profile of this medication in particular is directly related to the way that it works. Now, I have patients that I've used this medication in that it can be used as a deterrent. So in other words, if you know you have a sweet spot for buffalo wings or, cheesy pizza, when you have this medication, if you understand what will happen to you, and specifically urgency to go to the bathroom, a change in the character of your bowel movements. In many patients, they have used that as a deterrent to force them or to sort of help them with modifying their fat intake. So the side effects are directly related to your dietary fat, and this side effect can be leveraged to aid with behavior modification. Now, because this medication alters your fat absorption, there are certain micronutrients, in particular vitamins, and there are also certain medications that require fat for absorption. And so with patients who are on this medication and in bariatric patients in general, we like to check certain vitamins, fat-soluble vitamins, to ensure that you don't develop a deficiency. And if you do, we can be aware and we can replace what's deficient. Next. The other major category of nutrients that the metabolism or sort of the breakdown is pretty central to your weight maintenance is sugars or carbohydrates. So there actually was and Dr. Williams sent me a New York Times article about a medication similar to liraglutide that is getting a lot of press these days. So liraglutide's two other names, has FDA indications for diabetes, and the diabetes medicine is Victoza. And Saxenda is the FDA indication for weight loss. It's the same drug. The company just did studies showing that it works for both conditions. And what this drug does is it stimulates the activity of a hormone that's secreted from your gastrointestinal tract called GLP. And this hormone does a lot of things in the body, but for the purposes of weight loss, it slows your stomach emptying, which results in fullness. And so if you can imagine you feel more full, you're less likely to eat as much. Similar medications like this, and I put in bold the GLUTIDE part of it, so I call them the glutides. So there's semaglutide, there's liraglutide, there's a couple other glutide medications that work in a similar fashion and have weight loss as a side effect of these medications. That is a totally acceptable side effect when you're trying to lose weight. So for patients who already have existing diabetes and who may already be on other diabetic medications, I typically don't prescribe these because the risk of your blood sugar running too low is significant. However, for patients who are not, or who are only have mild diabetes or who aren't on any other medications, these medications I am comfortable with prescribing. Again, I'll just reiterate the cost considerations for these drugs. The other thing to consider is that these are injectable medications. And for some diabetics, injections aren't so much, they're not a deterrent because they're used to checking their blood sugars or even doing injections for other medications. So the injection piece of it can be a deterrent, but these medications can be extremely effective. And although not FDA approved, the next drug I have here is called metformin, and metformin is actually, I think it's in its 30s. It's in its third decade of FDA approval. The other name for it is glucophage. And I listed here because although it's not FDA approved for weight loss per se, there was a big study about 15 years ago called the Diabetes Prevention Program study. And that study took a lot of patients who had risk factors for developing diabetes, and they put them in different groups. One group got metformin, another group got just intensive diet and exercise, another group got a combination, and they followed these patients to see who developed diabetes. And interestingly, the patients who were in the intense diet and exercise group were less likely to develop diabetes. However, and that was after the initial analysis, but 15 years later, they published a follow-up study and were able to show that the patients who were in the metformin group who lost weight actually maintained their weight loss compared to those who were just in the diet and exercise group. So there is something there with metformin. The mechanisms are not entirely clear. We know that it sort of helps your body use its insulin a little better, but there's been a sort of renewed interest in utilizing metformin in combination with other medications. And I've seen some success in my patients. Next slide. And then this is the last class of drugs. I call them the sort of other mechanisms. So you may have heard of the drug Contrave. That's a combination drug of bupropion and naltrexone. Bupropion you may have heard of as Wellbutrin, which is an antidepressant. And naltrexone is a medication that blocks opioid receptors. And what I have here on the right side on the top is a picture of the brain, and it outlines a particular system in the brain that is integrally related to your rewards. So when we eat something that we like, there are certain signals that we get. When we have other behaviors that we like, it sort of sends us positive feedback. And this is a system that is sort of heavily under investigation, has had lots of study, and this medication, Contrave, blunts the signal sent from that symptom that drives the positive response to certain foods. It doesn't suppress your appetite, but it can help with mitigating and sort of suppressing cravings, and also in turn would help you with portion control. So I usually give the example with Contrave. So if you love chocolate, you may still want chocolate, but when you have a piece, you may not necessarily continue to eat chocolate. You'll be able to stop because the usual feeling or the euphoria that you're used to getting with that is absent or reduced. Again, this is another medication that has two drugs that alter the central nervous system or sort of brain hormones. And because of that, specifically with mental health drugs, antidepressants, anti-anxiety medications, we have to be very, very careful about drug-drug interactions. I have patients monitor their mood, and cost is definitely an issue for this medication as well because it's not yet available in generic form. The next image under the brain is showing you a brand new, and I guess it's been approved for a couple of years now, but unfortunately it's not widely available. According to the company, it'll be available for widespread use for prescription in 2021, but it hasn't been as yet. This is called Gelesis 100. The other name for it is Plenity. So it's considered a drug, but it's more of a biocompound or sort of biologic material. And what I mean by that is it comes in pill form. So you swallow capsules, and inside the capsules are these small particles that are absorbent hydrogel that comes from a material called cellulose. And what it does is it absorbs water and it expands. So if you think about a sponge is very porous. You put it in water and then it sucks up the water and it expands and it takes up space. So when you swallow this capsule, you can see the young lady in the first panel, she's swallowing her capsule. Then in number 2, the capsule is opening within the stomach with lots of fluid. And then in the third panel with the food, you can see the particles that were inside the capsule expanding. And so your stomach sends signals to your brain after you have eaten because the stomach has stretched to a certain capacity and it says, look, I'm full, stop eating, I can't accommodate anymore. And the mechanism of this medication or this compound is that it encourages or sort of forces your fullness by absorbing lots more water. And like I mentioned, it's not yet routine or sort of widespread availability just yet, but it's expected this year. And in some patients, it's not appropriate because if you can imagine that amount of expansion would not be appropriate for somebody who's had a gastric bypass or even a gastric sleeve who has had significant reduction in their stomach capacity. There are also patients that I take care of with Crohn's disease or celiac disease who this medication may not necessarily be appropriate for. But again, that is why you have medical professionals that sort of go over, review your medical history with you, other medications, and present you with the options that are most appropriate for you. Next slide. So this is just a summary slide with a table of the FDA-approved drugs, their mechanisms, the pros and the cons. And then from here, I will end and entertain questions.
All right, excellent. Thank you, Dr. Pickett-Blakely. All right, let me pull up everything here. We've had phenomenal discussion happening here off to the side in the chat. Okay. Lots of questions for you, so I'm going to line these up. First, I think it would be good to start with a question from Elizabeth that I think really we field often in bariatric surgery of why are we talking about medications in bariatric surgery? If you have surgery, doesn't that mean that you can't go on medications?
That is a fantastic question. So I hope this is not an unpopular opinion, but I view weight and weight maintenance as a chronic condition that can be lifelong. And that is from anywhere from my patients who have difficulty with gaining weight to my patients who are interested in losing weight. And I think that should frame the way you look at this. Now, there are some patients who have their surgery and who have a significant amount of weight loss and do fine in the maintenance phase of that weight loss. And if you do fine in the maintenance phase, you don't struggle with cravings, you don't have significant weight regain, then that's fantastic. However, we have to recognize that the body is built to avoid starvation, and our bodies are hardwired to maintain weight, and we're not by nature built for weight loss. And so with that, it is not, I wouldn't say that it's common, but it does happen that years after your body has sort of gotten really savvy for the effect of your initial weight loss to wane a bit. And it takes more work and more exercise. We have to also recognize that life happens. So you could have surgery, do extremely well, and need a knee replacement. And that sort of compromises your ability to exercise. Or you can have your surgery do extremely well for 5 years and develop a condition where you need steroids and you gain weight with your steroids. So we just have to recognize, I think that it's important to recognize you definitely want to achieve success with your weight loss surgery, and that the vast majority of patients do extremely well. However, you have to be prepared. There's nothing like preparation. You have to be prepared when those bumps in the road occur, and these are options.
I think that's a wonderful perspective overall. And I think that most of those who come into our office hear that often of, right, it's not if you experience weight regain, it's when, right, and how much and what do you do about it when that happens. Right. So excellent, wonderful, thank you. And also pre-op for many patients, just from a safety perspective, many times they're recommended to lose weight preoperatively. And that could be another tool in the toolbox to help them. Absolutely. All right. So shifting over, a comment from Joyce that I loved. She had mentioned that you really set expectations, which just as a clinician, I love that. That's wonderful that everyone's picking up on it. So let's shift over a little bit into cost and money and coverage. So Jay is post-op. She's starting anti-obesity medications and pharmacology treatment to help with some weight regain through COVID, she had said in the comments here, and that she unfortunately has to pay out of pocket for this and has to really manage her finances. We also have a comment in here from Barb about how she finds it odd and illogical that insurance companies pay for surgery, but they don't pay for medications. Do you have any additional comments around the finances related to treatment?
We can have a cup of coffee and have lots of conversation about that. It is, I think, odd is an understatement, especially when we talk about preventing weight gain and significant comorbid conditions to the point where you need surgery, but that it sort of is what it is, so we take what we have. I mentioned that there are sometimes some creative workarounds. So phentermine is pretty old. Topiramate has a generic, and it's not uncommon that I use those drugs well, I use phentermine for weight loss, but I'll use topiramate off label in the generic form. And there usually is not pushback from insurance because they don't know what I'm using it for. So for all they know, you have migraine headaches that I'm treating. It would be odd for a gastroenterologist to be treating migraine headaches, but hey, it's 2021. We do what we have to do. So I do use those medications in the generic form. Topiramate is often covered, and phentermine, although it's not covered, it is affordable. Orlistat is available over the counter. And I've seen that in anywhere $CVS, Walgreens. I've seen 60 tablets for around $35-40. And, I hear that that's not, it's not $5 or $2. But if you think about a patient considering using it 3 days a week, or when they go out, or using it in certain scenarios, and every drug cannot be used in that way, but that particular drug can be, and it sort of enables you to stretch. One of the other tools that I suggest to patient, or sort of tricks, is to go to wholesalers like BJ's, Costco's, Sam's Club, where you can often get generic medications for substantially lower prices. I've seen in the Saturday, Sunday circulars coupons for Orlistat. Patients will combine those. BJ's has double coupons. I mean, at the end of the day, it's about being scrappy and sort of doing everything that you can.
Yeah. And I will add to this of not only for getting treatment for yourself, of kind of an advocacy end. Many of you know from other support groups, if you've joined us for other ones, I am very active with some of the advocacy groups. So what you can do to help with saying this is needed. So two different things that I would suggest to you is, one, whoever provides your insurance, those are let's say it's your employer, you purchase it through the healthcare exchange. Those are the channels that you go through to advocate for yourself. If you have government issued insurance like Medicare, that's a little bit different. So it gets complex fast. So a group that we've talked about before in these sessions is the Obesity Action Coalition. And it's a patient and provider advocacy network that works together to talk to legislators, talk to employers, talk to insurance companies to be able to push for coverage and negotiate these. So if you're looking to get into advocacy, Obesity Action Coalition is where you want to go. All right, so we have two very specific medication questions for you here, Dr. Pickett-Blakely. So we have one from Fran saying, are there certain weight loss medications that are best for prior to surgery? And then James is asking, is there a specific medication for if you're a stress eater? So how do you know, like, what's the best specific medication for you?
So if I think about that slide where I had the magic wand, the real magic in medications is selecting the right drug for the right patient. There have been some studies looking at weight regain in medications in that scenario, and fewer specifically in the patient who's leading up or sort of progressing to bariatric surgery. I can speak from my practice. What I do is I go through first, look at medical conditions that would prevent me from using a particular drug. And a lot of in my first visit, the visit is about an hour long, and we do a lot of talking. I ask about eating behaviors. I ask about binge eating. I ask about nocturnal or evening eating. I ask about skipping meals. I ask about, hunger and cravings. I ask about what food was like growing up. Were you from a family who there were 5 of you, and when the bowl went around, you had to get everything that you had to get at that time? Were you from a household where you had to eat everything on your plate, or so I try to get into behaviors and sort of try to understand some of the issues that are driving. And for most individuals, it's not just one thing. But I will say, if I pick up that fatty foods, processed foods, fast foods are something that are big in terms of what you're eating, then I think about Orlistat. If we check your labs and you're diabetic or pre-diabetic and hadn't been diagnosed or treated, then I go for one of the metabolism drugs as far as glucose control or metformin. Most people have cravings, and I'll just reiterate that I don't like completely suppressing appetite and cravings, because one of the things that I notice in practice that is not addressed is addressing the root of cravings and other modalities to suppress them. So it's one thing to give you a medication, but when you go off of the medication, or you run out, or you move and you can't get another refill, what do? So that's where things like mindfulness and meditation and other sort of workarounds. So my formula is to talk to each and every patient is on a different mix. I mean, I have people on metformin, orlistat, phentermine, topiramate. And so some patients have been on other drugs for other reasons and had side effects, so we can't go there. So it really is an individual choice. So short answer, there's not one specific medicine I use for weight loss beforehand. And I would say cravings and binge and sort of portion control, appetite suppressants, and even the reward system blocking drug Contrave would be a good choice.
Yeah. So it sounds like it's very individualized.
It's very individualized.
Okay, excellent. So Dr. Pickett-Blakely, we're looking at wrapping up at this point. So I'll give you an opportunity. What do you want to leave this group with tonight? What message do you really want to send home?
I think that what I'll say is that, managing your weight is a process and a journey. And just like you may be on 2 medicines for blood pressure, well, hopefully not anymore after your surgery, but 2 blood pressure medications, or 2 medications to stabilize your mood, or you use multiple things to get what you need from your children, or you employ different tools to get the best out of your relationships at home. There's no reason that your weight and your weight loss journey shouldn't be any different. So if you have surgery, that may not be, the end all be all. You haven't lost anything if you need a medication. You should not view it as defeat or you've lost something. What we do is we look at it, we accept the challenge, and we sort of figure out how to work around it. So I would just encourage you to use every tool in your arsenal to get the results that you need.